Welcome to the 9 Health Fair, and thank you for volunteering to perform pap smear screenings today. You will have a kit of supplies that come in a box labeled pap smear exam. Everything you need to complete the exam is in this box. You will need to grab a few things for your site. You will need a pap smear screening table with stirrups, a gooseneck lamp. You will need to have a sink readily available, a large wastebasket with liners, markers, Sharpies, pens, and paper to line the table. Your kit will come with requisition forms. You will also need to have pap smear screening protocol printed off so the screener has access to this. You will want to have the pap smear screening guidelines for the screener as well. Each screener will need their own tally sheet. You will have a volunteer review the pap smear screening guidelines to ensure that the participant qualifies for the pap smear. You do not have to make copies of the pap smear screening guidelines. Simply put it in a plastic sleeve for the volunteer to use. You do not have the participants pre-fill the requisitions in advance because they may decide not to have this screening, and one form goes with one specimen container for each pap smear. It is important that you fill out the requisition form in all of the highlighted areas. You will need to fill out the date collected, the patient's complete name, the date of birth, month, day, year, the sex, patient phone number. This is very important that we have this in case we need to contact the participant, and a complete mailing address so we can mail the result to the participant so they can share this with their healthcare provider. We will also need you to fill out the GYN cytology areas that are highlighted. Once the pap smear is completed, you will need to place the requisition form on the outside of the biohazard bag. Please don't forget to give the participant their copy, which is the second copy. You will fold the form so that the patient's information shows on the outside of the biohazard bag. You will then take the specimen container with the name and date of birth that match exactly to the requisition form you just placed in the bag, making sure it's sealed tightly. Put it in the inner package, and this is complete. You will then place the completed specimen in the box provided by 9 Health Fair in a liner. You will name it pap smear and your site name and take that labeled box to the lab area once the fair is completed. Quest Diagnostics will take the completed pap smears to the lab and return any unused supplies to 9 Health Fair for repackaging. You will want to make sure that you have a screening schedule guideline. There are several examples in the resource guide, or you may create your own. You want to make sure that the screener has enough time to screen all of the participants in the waiting area. If the screener does not have enough time to perform all of the pap smears, you will need to close that screening down. You will also have a tally sheet for each screener that will need to be returned to the 9 Health Fair. The female attendant who is accompanying the screener for every pap smear can help determine the time frame and how many pap smears can be completed. Some other important reminders. If a lubricant is needed, it must be a non-petroleum-based lubricant such as KY or a generic equivalent found in the kit. Please remember to record the participant's results on line S of the participant's yellow copy. And don't forget to give them their copy of the pap smear requisition form as well. If you have any questions, please call 9 Health Fair and ask to speak with a healthcare professional at 303-698-4455. And thank you for taking part in the 9 Health Fair.